So tomorrow, poor little buddy has to go back to the vet, and he will be kept there, and they're going to explore his foot a little and possibly do a biopsy. So it's not going to be a fun day. It's Monday, and we had a really rough morning with Tonto. He was vomiting, and it was what they warned us about on the medication bottle. The medicine he started last Tuesday when I took him to the vet. So we're going back to the vet tomorrow morning. He's been eating the chicken and rice that you saw me cooking all day. He cannot eat after 9 p.m. tonight. So I don't know if you guys know about this, but there are certain things that grow like foxtails, certain grass seeds. There's also like a Spanish needle. All of those can get lodged into your pet's fur and migrate and cause a lot of damage. I suspect that's what's going on in Tonto's foot. The vet thinks differently, but she did agree to explore tomorrow when she sedates him and puts him out so she can do a biopsy of this growth on his foot that just popped up and progressively got worse. Then we went to the vet last Tuesday. She put him on antibiotics and anti-inflammatories. It is still spreading. So I believe it is a foreign body, like I mentioned, one of those items, because we have been picking those off his fur in the last 2 weeks. So to me, that's just too much of a coincidence. I'm picking foxtails off. I'm picking Spanish needles off of him. One was actually embedded in the top of his back. So we'll see. It's a new vet. I can't see my regular vet. So I'm really like high anxiety, high stress, and worried about Tonto. So I will give y'all an update, but tomorrow is going to be all about Tonto. He's dragging me everywhere. They did agree to let me bring him in late, right before surgery starts, because normal protocol is to drop him off at 7:30, and then he sits in a kennel for like 3 hours until the doctor's ready. But Tonto has severe anxiety, so he will not be doing that. He will be sitting with me until the appointment time at 11, and then I will bring him in. And I will probably just sit out in the parking lot and wait. I'm not sure. I may try to get some errands done because I will be just sitting there stressed and worried. So let's take a peek at Tonto. So as we're walking, I'm looking all around. I'm like, oh no, are there foxtails over there? Are there Spanish needles? Is he going to get some of these seed heads into his coat and they're going to get into his skin and migrate? They can migrate into like their lungs, all kinds of areas. So, and then I'm also looking out for snakes because my neighbor's dog got bit a couple months ago. I mean, it's really not the season, but anything's possible nowadays. I think I could find a snake in January if I really wanted to. So we are getting a nice long walk in this afternoon. Tomorrow I'll try to give him a walk in the morning, and then we will head to the vet. So positive thoughts, prayers for Tonto again would be great. Thankfully, I bought pet insurance when he was 9 months old because he was a very bad boy and he liked to eat everything. And we had so many near misses of foreign body surgeries. Thankfully, most of the time he was able to vomit the items up. So we had a lot of close calls when he was a puppy. And so I went ahead and got that insurance when he was 9 months old. And that's a good thing because between his latest vet bill a couple months ago and last week and this week, I'm looking at quite a big chunk of money. So I guess I can thank my past self for getting that pet insurance. I do recommend that, especially if you have a puppy. It's harder to get when they get older. We use, I think it's called Best Pets or Pets Best. All right, Tonto, do you want to say goodbye? that is what's going on with Tonto and Mom, because I am like very worried, high anxiety about this. Well, at least someone is eating Tonto's food today. Jeffrey. So today is Thursday. It actually, oh, I'm sorry, it's Wednesday. I'm losing track of time. Yesterday was Tonto's surgery. They did actually go in and find a mass or a tumor, and they tried to remove every piece that they could, but because it was kind of growing off of the nerve and in between two digits of his foot, they tried their best. There was lots of blood vessels and ligaments and nerves and so forth. She said she tried to get every last bit, but it might have been impossible to get every piece of that mass or tumor. What she did remove, she has sent off for biopsy. She's afraid it is a nerve sheath carcinoma or sarcoma. I think I'm saying that right. Sarcoma. So we are just gonna do recovery now for the next 10 to 14 days and pray for the best. Tonto is doing okay. He is having a hard time though with restrictions of movement and being inside. So I am sitting in this chair watching him to make sure he does not get near his foot. He does not have his cone on right now because I wanted him to be able to see as he was walking. Just kind of walked him around the yard a little, hoping he would go to the bathroom. He's having some issues with that due to all of the narcotics and tranquilizers and pain meds. Surprisingly, he's very alert right now, which I'm surprised. He's just kind of bored. So it's been about 24 hours since the surgery. He's very happy though to watch the new puppy 2 yards over. So I was wrong about it being possibly a foreign body. I was suspecting maybe like a foxtail seed head or one of the Spanish needles had lodged in there. But it was in fact a mass, a tumor. So if it is what she suspects, that type of cancer will almost always come back, but it is usually localized to the general area. Like, it usually does not metastasize, but it does like to come back. If that ends up being an issue, we would have to maybe talk about amputation. And also, after we get the results back this time with this biopsy, we will have to talk about radiation. If it is indeed cancer, you will need to do some radiation. Thankfully, like I said earlier, Monday when I did the video from the other day, we do have pet insurance. Vet bills are just unbelievably expensive, like pretty shocking. Hey buddy, are you getting tired? You want to go in for a nap? Yeah, he's getting really, really sleepy. So that is the update on Tonto. Even though I was wrong about the foreign body, you do still need to watch out for that. That is something to keep an eye on with your pets. And we do pick those off of Tonto occasionally. But this time it actually was something else. It was the tumor. So just keep Tonto, in your thoughts. He is getting very sleepy, which is good. So you can go in and rest, and I can go in because it's very cold. But I got on some double layered gloves, and I'm happy to give him a little break outside because he is getting bored and tired of just laying around. Even though it's only been Well, I picked him up at 5:30 yesterday, so it really hasn't been that long. I will say it's going to be a very, very long 10 to 14 days. Right, Tonto? Oh, no, 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 no. And normally we do have the cone on, but since I'm directly supervising him, no, that's a no. I don't need it on, but he's not allowed to touch his IV site or the tumor site where they remove the mass because he has a lot of stitches. I'll put a picture right here, but if you're squeamish at all, look away for the next 2 to 3 seconds. Okay, well, here is a gardening thing I can close the video with. Remember when I planted all of those little muscaries, the bulbs that get the pretty blue flowers? They are coming up quite well, at least until Tonto digs them up.